We know this from surveys that the language that we choose makes a huge difference to what we see as ethical and unethical. And we can even see that in surveys of the general public, that if you go out to the general public and you ask them, do you agree with physician-assisted suicide and euthanasia, a certain percentage of them will say yes. But if you drop the words physician-assisted suicide and you call it medically assisted death, and you drop the word euthanasia, the percentage of people who agree with it almost doubles. And the people who are pro-euthanasia, for example, have taken a huge advantage of this. And the one thing that they will never talk about, never use, is the word kill. Should we have doctors killing their patients? When you ask that question, they object that that's not what we're doing. And then you say, well, if it's not killing, what is it? And of course, that's what it is. In Quebec, where I've been living for the last 40 years, they legalized euthanasia there last December, and the Quebec government proposed sending out a so-called euthanasia kit to every doctor registered to practice in the province. And the euthanasia kit had enough lethal medications with instructions of how to use them, and it was a tripartite process to kill the patient. First of all, they gave them Valium because they said they didn't want them to be anxious about what was going to happen. Then they gave them a very strong barbiturate to render them unconscious, and then they used a muscle paralyzing drug to kill them. And they even had instructions for what to do if this goes wrong, in inverted commas. That is, the patient inconveniently doesn't die. And